So first of all, thank you very much for coming today. For those that I've not met yet, my name is Charmaine Jackson and I head up the training team for Ardens. I'm also joined by my colleague Mariette Hadfield, who's one of our training specialist leads, and I'm sure you've also met Mariette too. She's been on a number of our webinars. Mariette is pretty much going to be leading on this webinar today. The webinar that the topic we're focusing on is planning and monitoring GP contracts. So this is mainly for Ardens Manager. We want to show you how you can use the dashboards to be able to monitor your QOF and network contract DES. And those are the two areas that we're mainly going to be focusing on. Now, before I talk about housekeeping, I just want to say that anyone's welcome on this webinar today. It doesn't matter whether you're an EMIS practice, a System 1 practice, whether you're using Ardens Manager, whether you're not using Ardens Manager. Hopefully, all of you are going to find it very, very useful. But in terms of housekeeping, same as what we normally do. You're not connected to a camera or a microphone. If you do want to answer us any questions, then please use the Q&A section. We've got our really good support team lead, Georgina Ford, who is there to answer your questions, and I'll dip in and help with some questions as well. If you have any feedback about what you're seeing, then please feel free to use that area to do that too. And you may want to find where it is just in case you are new, you're happy with where it is. Like I mentioned, the session's scheduled for about an hour and it will be recorded, and we will make sure that we email that out to everyone that's registered, and it will be available on our website too. Heads up that we are introducing a new YouTube channel which you can subscribe to, which is brilliant. So every time we put a recording in, you'll get a notification that there is a recording. So more details on that over the next coming weeks. Now, in terms of what we're going to be covering today, so just next slide for me, please, Mariette. We're going to be mainly focusing on QOF and network contract DES, like I mentioned. We don't want to bombard you with too much information. So focusing on those two areas, we're going to provide you with a very brief summary update for each of those. Then Mariette's going to take you into a live demonstration so we can actually see it working for real in Ardens Manager. We're then going to talk about next steps, and we're also going to be looking at training and support too. Now, before we dive into QOF, which is the first area we're going to cover, I am just going to pop some poll questions up because, first of all, it would be good to understand who we actually have in the room. Let us know whether you're a practice manager, perhaps you are working as part of the admin team, you're a clinician, perhaps you're working in the ICB, or maybe you're a PCN staff member. Maybe I've not listed your role at all. Click other and let us know in the Q&A what your role is. And if you just go ahead and answer that question, we can then have a look at what the results are. Thank you. Lots of admin. Lots of admin online today. Actually, no clinicians yet. Lots of admin. I've got a couple of PCN staff on there as well. Perfect, thank you. Now, my next question is really to understand whether you are an Ardens Manager customer or not. It doesn't matter whether you're not, because you're still going to find this webinar useful, but it's just useful for us to know how many Ardens Manager customers we have in the room. So I'm just going to launch this question now. If you're not sure, that's okay as well. Just hit not sure. Okay, pretty much all of you so far are Ardens Manager customers, which is good. I'll just leave that for a little bit just to get some more responses. Yeah, all Ardens customers, Ardens Manager customers. Okay, Mariette, next slide then. So, as mentioned, we are going to spend the first part on QOF, then we're going to move to network contract DES, starting with QOF because, as we know, it's probably the biggest area that you focus on when it comes to GP practices. And we actually did GP contract webinars back in April time, end of April, where we spoke about what the changes were in detail, and then we looked at all of the Ardens clinical resources that were available to you. So we spoke about recalls, we spoke about templates for EMIS customers, you had a brand new QOF report. So it's really, really, really important that you've listened back to those webinars if you haven't, and my colleague Georgina will pop in the links so you can watch back that recording. We just go into a little bit more detail about what's happening with QOF this year. But really, in summary, and hopefully most of you are aware of this anyway, but the point value has gone up. It does that every year anyway, so it's now at £227.95 for this financial year. They have introduced some newer indicators across cardiovascular, diabetes, obesity, and heart failure. Well, they say that it's new, but it's not really new because you were doing a lot of this work in other areas and they've kind of just shifted things around. So you've got a new domain, for instance, which includes some of your indicators in there. Because of all of this shifting around and adding new indicators, particularly obesity looks quite new for this year as well. They've also included 18 additional QOF points for what you can work towards. And there was also a few threshold and point adjustments and really small changes, such as asthma. The register is now looking from 5 rather than 6. We're so used to it being 6, that's now dropped down to 5. There was also some good news about childhood immunisations. I'm sure Mariette's going to speak to you about that today as well, but there was an improvement threshold in place now, which will help you with achieving in this area. And for all of this, we want to be able to support you as much as possible. So I'm going to pass you over to Mariette now so that she can talk you through how you can use Ardens Manager to plan ahead, prioritise, manage your workload. And while Mariette's switching to her Ardens Manager screen, I am going to launch another poll question because we've got a load of you who are an Ardens Manager customer, but it'd be really good to understand whether you used the QOF dashboard last year to support you with your performance. So that's the Ardens Manager QOF dashboard. Did you rely on it to help you with your performance for last financial year? I'm just going to launch that question now. Hopefully we'll get a lot of yeses. Perfect. Well, actually, quite a mixed result there.
Yeah.
Quite a mixed one. So hopefully those of you that said no or who was not sure, hopefully a lot of that will change after Mariette's done the presentation. So no pressure, Mariette. Over to you.
Lovely. Thank you, Charmaine, and good afternoon, everyone. So for today, we're going to start off, first of all, with an overview of the QOF dashboard, particularly for those of you who are new to it. This might be the first time you've seen it, so we're going to make sure that you know exactly where everything is and what we're looking at before we look into how you're going to use it to plan and monitor. So first of all, what we want to cover is user management. So one of the key steps to planning and getting everybody on board with your QOF is making sure that you have all the right users set up and that they have the right permissions in place to view patient level data. What we're going to do first is on the home page here, we're going to click on the account settings button, and this is where you can access the details for your practice. This is a demo system, so my lists on here are very, very big and it's got lots of information in, but hopefully you'll have just your practice listed under this organisation section on the left. So I'm going to be using our demo practice Garden View Medical Centre. I'm going to click on that one and then everything opens to the right where we're going to click on the users tab along the top here. If you are a system administrator, you'll be clearly labelled as admin in the admin column. You've got the ability to add any additional users to your Ardens Manager. That is unlimited. You can have as many staff on here as you want to help to support you with any of the work across Ardens Manager. Simply click the little blue button at the top here. Enter in the user's email address, click OK, complete a couple of details there, and then click OK again. That's it. We send them an invitation in the background to join the platform. Your next step, once they've signed up, would be to check that all of your members of staff, where relevant, has patient access enabled. So on the far right-hand column here where it says patient access, this is where you will see that. So for any of your users that do not say enabled in there, you can just click the 3 little dots at the very end and you'll have enable patient access. Click on that one, the screen will refresh and that will now be fully enabled for those members of staff. To be able to use that, just make sure that you inform your staff that they must log into Ardens Manager with their smart card to be able to then see the list of the patient names behind the scenes. And that's it for your user management, nice and simple. So we're going to click back to home to go back to our home page. Now to access your QOF dashboard, we're going to come along the left-hand panel here to the contract section. And this is where you'll be able to see anything contract related. So that's where we'll find our QOF as well as the network DES, which we will look at later. So I'm going to click on QOF 2627. For every QOF year, you'll get a fresh dashboard so that you've always got the previous one to refer back to should you need to. Now, in terms of general navigation, for those of you who are new to the QOF dashboard, When you first click on your dashboard, you'll notice that it loads up into the overview page at the top here. Now, all that means is it gives you the entire QOF contract with all of the reports and indicators on a single page. If you are monitoring things, that might be okay, but if you're regularly working on specific indicators, you may find it easier to use the tabs just along the top here. These are your domain tabs, and they separate out each one of those different areas, and it just makes it a bit easier to navigate. As we move down the screen, you'll see we're currently on the data tab, so that is where all of your reports are, along with all of those key numbers that you need. You do also have a contract tab available. What this one does is, just to quickly show you, is it summarizes the contract for you, but the important bit to show you here is if you scroll all the way to the very bottom of that dashboard, we have linked the specifications for you. So if you do need to read up about any of the indicators in a little bit more detail, when you follow that link at the bottom there, it will take you directly to the guidelines. So hopping back to the data dashboard, because that's where you're going to be doing the majority of your work. So we're going to click back onto the data tab, and we're going to stick with the overview for now, just so that you can see everything on this page and what it refers to. So the next row down, you've got the overview of your points. So on the overview page, it gives you the points for the entire contract, whereas if you're clicked on the domain tabs, it will be just the point summary for that particular domain. But on here, we can see, first of all, the points achievement to date. So every day there's a fresh data upload to show you what your points achievement is to date. And that is out of the total of points available for the contract. Just over to the right a little bit, you'll see there's a bar chart. That is designed to give you an indication of scale for each one of those different indicators. So we can see here in terms of points that cardiovascular, our CVD domain, is the biggest one this year, again with a total of 237 points available, and again closely followed there by diabetes with 114, and so on. So it's a nice visual indicator to show you where you may want to start prioritizing specific domains to make sure you are covered in terms of resource. Now, as we work our way down the screen, you will see that there are three separate sections. You've got, first of all, your clinical activity. So that is all of the reports relating to those indicators. We'll circle back to those in just a sec. You've then got a space for case finders. And again, we will cover that in a little bit more detail, but that's where the majority of your case finders are. And then at the very bottom, you've got a very nice domain overview. So for those higher level conversations, particularly for management, where you're having to track your progress with each individual domain and service within there, this just gives you a brief summary as to how many points you've achieved and how many points remain. Now, circling back to our indicators, in terms of your clinical activity, we can show all 99 reports. That will give you an idea of the volume of working with the overview here. So you've got all of your indicators and reports listed along the left-hand side. You have a view button that helps you to break the report down. You've got these really handy tracker bars next to the view button, which basically shows you how close you are to your different thresholds. So the dark grey colour is your current progress, and that will then track all the way to the dotted line so you can see how far away you are from your minimum and your maximum threshold. You've got these little mini trend lines here. This shows you what your data is doing recently. So is there movement? Is it just static? And again, that could be a nice indication as to where you may want to focus your attentions. Moving along the columns, you've got a threshold column that documents what the percentage thresholds are for each indicator. You've then got the achieved section. This is based on a traffic light system. So again, giving you that visual cue as to how well you are doing. If your traffic light is red, it means you're below the minimum threshold, so no points. Amber, between the two thresholds, and your points will start to accumulate, as we can see with this one at the bottom of the screen, until you reach green, which is your maximum threshold, maximum points, and where you want to be for most of your indicators come the end of the year. The figures around this one, again, the count just shows you the amount of patients you've achieved out of the cohort for the indicator. And then you've got a remaining to achieve column, which I think is one of the most important columns on this dashboard. So this gives you an indication as to how many points remain for each indicator, along with the amount of patients that's going to get you to that maximum threshold. And you do also have a new work to do column that just shows you the total amount of patients who still need work doing. And finally, there is an assigned column where you can assign users, but again, we will come on to that as we go through the demo today. Last thing just to point out before we dive into this is the dashboard is automatically set to end of financial year. For those of you that prefer working with how am I driving, just remember to give a manual toggle on the dashboard here to change that view. So that is a rough guide as to how you would work your way through this dashboard. So looking at how we're going to utilize this today to start our planning. So the first thing that we want to do is to review our cohorts for each of the indicators to see how many patients we have on our registers and who need the care versus what is left to do for our threshold work as well. Now to do that, you can do that in one or two ways. You could stick to the overview page where you've got access to all of these different indicators, or we can just go directly onto each domain and split it out that way. So for today's demonstration, I'm just going to use the respiratory tab here. Now, as we can see, this summarizes respiratory nicely for us. So we know that's 44 points available. Currently, I haven't achieved that yet. And then as we come down the screen, you'll see it's nicely separated out. So visually, it's a little bit easier on the eye. So it starts off with the asthma section. Here we can see any personalised care adjustments. We've got our 2 review indicators, as well as a category for time sensitive. Underneath that is also the case finders that relate specifically to asthma. But let's look at reviewing our cohorts first. So in terms of our asthma indicator, for asthma reviews, we can see that we need 70% achievement to get maximum points here. In terms of my cohorts, I have 83 patients in this cohort that need that asthma review. 59 of those patients will get me to maximum achievement for that one. So I can now start to plan how I'm going to divvy that out. Now, it might be a simple math calculation here to say, we're currently in May, we've got about 9 months left to achieve our QOF. We're going to take that 83, divide it by 9, and that gives us a rough idea as to how many patients we need monthly to reach 100%. Now, we don't need to get to 100% to achieve QOF. So an easier calculation might be to use your remaining patients, so those 59 patients, again, divide that by 9, and that will then give you that rough idea as to how many patients you need to achieve each month to be on track with your QOF. Now you can go into that in a little bit more detail if you wanted to plan even further than that. To do that, we're going to click on the View button to start breaking down this report. Now again, for those of you that is new to Ardens Manager and haven't seen this before, brief overview of what you can see on the screen here. So you've got your benchmark tool, which operates on a data sharing agreement. So across your PCN or whoever is included in that data sharing group, you can see what their performance is, as well as what the cohorts are. So for my garden view, there is 83 patients, but within my PCN, I also have Sunrise Practice, who have 175 asthma patients, compared to Willowbrook, who have 483. And again, as the year progresses, you can then track what the achievement is there. Your next tab along is your patient tab. So provided you're logged in with your smart card and you've been enabled in the settings, that's where you would access the list of patients once you're ready to work on them. Now, over on the right-hand side is your detailed analytic tools, and that will include all sorts of things like a trend chart to show you what your data is doing over time. You've got demographics, so that will show you what the demographic breakdown is for your patients within this report, and in there you'll see age, gender, ethnicities, even down to deprivation data as well. Conditions. So this shows you what conditions these patients have. So we're currently on the asthma report, but as well as having asthma, what other conditions do these patients have? So we can see from the overview that some patients have cardiovascular disease, diabetes, but we can be a lot more specific. If we scroll down, we then break it down for you. So for our cardiovascular, we can see that some of my asthma patients, 4 of them have AF. And again, moving down a little bit, 12 patients have diabetes as well. And then finally, there's a risk category as well. So again, just helping you to analyze in terms of risk stratification, what the makeup of the patients within this report is. So you've got your continuity of care RAG there, so we can see how many patients fall into the green group or the red group, and so on. And lastly, just to show you that there is a map functionality as well, which you may choose to use. On the map, there is a drop-down for patient LSOA. Now, if you don't know what that is, think of it as postcodes. So within your local area, the patients will be plotted on the map as to where they live, and it's designed to show you density within your area. So those are your main breakdown options, and what you can do is use all of those to help you plan your QOF. Now, what I mean by that is if we think about demographics in terms of our asthma review, we may need to look at the age groups. So in here, I've got 13 patients who are 80 plus. Now, it might not be appropriate for them to come into the practice to have their review, or they might have other adjustments that we need to take into account for that. Again, with things like conditions, you may not want to invite your patient in for just their asthma review to later down the line see that, oh, they've got diabetes, and then invite them in again. So from a conditions perspective, this can help you to plan some of your multimorbidity clinics just to make sure that you get that every patient count section covered. And exactly the same for your risk. So if you are implementing your continuity of care model, which is part of the PCN DES this year, you can then separate out your red patients to make sure that they have continuity first. Now, to do all of that, you'll see just above the patient list, there is a filter, and you can click on that one, and this is where you would populate your criteria. Now, there's no restrictions here. You can have as much criteria in here as you want, and whatever you put in will update the dashboard. So for argument's sake, if we said we want to look at our 80 plus patients first, I can put that in there, click apply, and my whole dashboard now updates, showing me only those 13 patients and their analytic data for that. So within that, I can see that for those 80 patients, 8 of them are considered continuity of care red. In terms of conditions, 11 of those 13 patients also have cardiovascular disease. So it might be a smart move to plan to do those together with someone who can do both the asthma review and the cardiovascular review all in one go. And if you want to then filter further, you can add in as many things in here as you want to. So if we say all of our cardiovascular conditions, apply, and again, that now shows me just those 11 patients. So that's a rough overview of how you can do your planning, and you can use that logic for any of those indicators on there. So do go through, plan what you're going to do. Have you got enough resource? How are you going to manage these patients? So I'm just going to come back to the main dashboard on here. There we go. So now that we've planned, what we want to look at next is a different report. So with most of your indicators, one way of planning will be to look through those indicators, see how many patients you have, and work out what your appointment needs might be. Now, I did mention multimorbidity. So to look at things from a slightly different perspective, you'll see on those tabs along the top, in the middle, there's one that's called General. And what this one has is a series of work prioritization reports. Now, these are handy at the beginning of the year for planning, but they're also handy at the end of the year when it comes to mopping up any additional patients. And what these reports do is show you where your patients have multiple indicators outstanding. So the reason it's really good for planning is it can help you to identify those patients who have high volume work that needs to be completed. So starting at the top of the list, we've got 10 or more indicators outstanding. So I've only got 10 patients on this list. But I can click on view and I can then start to have a look at what domains this cover. What conditions do these patients have? And is there any way I can have multi-morbidity clinics to cover as much as possible of those reviews? So using those tools on the right-hand side, I can look at conditions. So on here, it will show me that the majority of those patients have diabetes, closely followed by cardiovascular and mental health, and so on. So a really good way for you to start to have a look at where you can maximize your clinical time with some of these patients. And it might be that you want to cover those patients first in the first half of the year before all your winter pressures come in. Now, another little useful tool while we're on this report is this view can show you what domains your patients fall under, but what they can't show you is what the indicators are that is outstanding. So is it all of their diabetes indicators or is it just one or two of them? Now, to help you with that, when you're working through these lists, if you click on your patient tab, you will see that there is a view button next to every patient. What this does, I'm just going to click that one, and what that does is bring up a single patient view within Ardens Manager. Let me just try a different one. Let me just refresh that page. Bear with me. Oh, no, I will show you on a different report. Basically, what that report does is it shows you every single report that your patient is associated with right across Ardens Manager. Now, I know that's a bit of a scary concept, but the idea behind that is that you can utilize that report to show you exactly which indicators is outstanding for that patient. So we'll revisit this when we look at some of the other reports to show you exactly what that looks like. So in terms of your planning, make sure that you are having a look at your general reports here for work prioritization, because that's going to be really useful for you if you want to go down the route of grouping multiple conditions together. Now, the next bit to go back to is setting your targets. Once you know what you're doing and you've planned what you're going to do, you may want to set some personalized targets around that. And I'm just going to use the asthma report again for that one, just for a bit of consistency. So we're going to click on view so that we can break down that report again. And this time we're going to use the trend chart. So that will default to the trend up here. And then as we scroll down, you'll see that it's got lots of different lines on there, so you can compare your data across your ICB or your PCN. I'm just going to turn those off by clicking on them. And the bit that we want to see is at the bottom here. Under the target section, you can have as many targets on here as you want. You can just click the add target button and a new line opens up. But here's some that I made earlier. I'm just going to enable them by clicking on them. And what this does is for every target you put in, you'll see a new coloured dotted line on the chart. So I've mapped out what I want to achieve with my asthma patients across the whole year. So we can see a steady increase here quarter by quarter, so that by the end of the financial year, I'm at 80%, meaning that I have hit my maximum threshold. Now, the idea behind this is you can use it to track your progress. Now, hopefully you can see just at the very bottom of the chart is a grey line, which is my current progress because I am on 0. Now, I can clearly see that that line is not tracking next to my predicted target. So I'm already halfway through June. I'm nowhere near my target line. So I can look at that and think, okay, we're not on target. What are we going to do to get back on track? So it's a really nice visual way for everyone involved in QOF to quickly see whether you're on track and where you need to intervene with any of your planning. Perhaps it means doing an extra clinic somewhere to get more patients in, or whatever that might look like for you. You've got the ability to measure your own progress on there. Once you have set your targets, we're now coming on to the assignment side of things. So the great thing with Ardens Manager is that you can assign different users to different reports on here. So it creates a nice to-do list for any of your staff. In the top right-hand corner, you'll see that little person with a plus icon, which we saw on the main dashboard. So you can do this either on your main dashboard or just through the report on here. Simply click on it. You can then add your member of staff on. You can have multiple staff. Again, there's no restriction. And then that will pop up a task for them to show them exactly what they're responsible for. So in my case, I've assigned myself to reviews done. There's 20 points missing and 59 patients still to achieve maximum threshold. Now, every day this updates. So let's say, for argument's sake, we have done 10 patients today. Come tomorrow, that list will drop down to 49 patients outstanding. So for the individual members of staff, it's a really nice personal to-do list, but also from a management perspective, you've then got oversight as to who you've allocated various different things to. Now you can take that a step further. You'll see just next to there is a little comments icon. When you click on that one, that allows you to leave comments on the report. So it might be that I'm going to put in here that I've set targets. I can describe what I've done with the targets. And then when I'm ready, I can post that. And then I can reply. So maybe in a month's time, I can come back on and say, we are not on target, and then explain what I'm going to do to get us back to target. You don't have to use it just for that. You can use it for general communication. So for those staff that are allocated to this report, they can leave general comments on here to say what cohorts they're working on. If you're prioritizing a specific cohort, you can record some details around that on there. It just keeps all that communication nicely in one page. So that's it from that perspective. Now, when it comes to actually recalling your patients and using this on an ongoing basis, coming back to the patient tab here, there's lots of different things you can do with your patient list. First of all, if you just wanted to invite all of these outstanding patients, you can filter your list at the top to show just those remaining ones only. And then at the bottom of the screen, you've got some bulk export options. Now, these are great if you want to invite the whole cohort. So let's say we want to invite them all in for their asthma review. You can use the CSV option, put that into your third-party bulk messaging platform, and send those invitations out. Job done. Alternatively, you have got clinical system import. Now, sometimes you may want that list of patients back in your clinical system, and that's what the second option is for. So rather than having to run another report to get them back, you can just click that button, click the export, and then bring that file over into your clinical system. Ardens Manager is designed to be interactive and for you to use the patients on here. So if we wanted to view that patient view again, I'm just going to see if it works for me. No. We will share the article with you at the end of this so you can see what that looks like. But you can use your patient view function to see what other work they might have outstanding. And the great thing with that is as well is once you've reviewed what's outstanding, you'll see in the top right-hand corner of that screen is a launch button. It's called Open In, and that will launch your patient's record in your clinical system, ready to go. The next function, just to show you as well, is all around the rules of the report. Now, sometimes it does happen where you think a patient should be in a report, or more importantly, you're wondering why are they in this report? We have got some functionality in here now to run through the logic to show you exactly why or why not they're in that report. This little question mark just next to view is where you can access that. So if I want to see why my test patient here is in this report, I can click on that little question mark. That will run through the reporting logic in the background, and it will come back and tell you exactly where it's failed or passed on this report. So it takes a couple of seconds just to run through the logic. You'll see it's grayed out, and once it's finished, that will tell me that they're excluded. So I know they haven't been achieved, but I can see why. So I can see that they haven't achieved this rule, or the second one, or the third one. So it's really, really clear to show you exactly where they are failing on that one, or importantly, why they're included. And when they are included, you'll also see the code along with the date that it was added in the record. If your patient isn't on the list at all, you can enter their NHS number at the bottom here, and that will show you why. Again, really useful functionality. And just on the topic of rules, on all of these reports, you'll see at the very end is a rules tab. And this one will give you access to show you how the report is built, what coding it's looking for, so that if you're not using any of the templates, you can double check the coding on this front. You can follow through any of these blue hyperlinks, which will take you on to the next phase. So this is looking for the review code. When we click on that one, that will then show you the 11 codes that is included within that particular domain. So coming back to our main dashboard, we're now moving on to case finders. Now, for those of you who don't know what case finders are, I'm going to stick to the respiratory ones for now, but remember you can get most of them on the, all together on the overview page as well. What the case finders do is they identify patients who might be missing from your disease registers. So these patients, it will look for information in their record to say that they may have asthma and they are not on your QOF register. Now, if that is the case and the patient is missing from your register, it means, first of all, clinically, that patient isn't receiving the care that they should be having. But financially, it means the prevalence is lower than it should be, which ultimately means your QOF value is lower than it can be. So highly recommend going through these case finders. Some of them can be done by admin staff, some might need to be done by clinicians, but there's lots of different types to get stuck into. So this very first one on the list, query asthma as asthma resolved, but they've had a repeat inhaler in the last year. So we can see from here, I've got one patient, so I would have to review that record to see why did they have an inhaler, has their asthma returned, and do I need to add them back onto the asthma register? If that's the case, add the asthma diagnosis code, and they will then be included on my list of patients who are registered for the indicator. So a really useful tool when it comes to planning your QOF. Have a look at the amount of case finders you've got, see what the numbers are, and then put together a plan. You don't have to do them all at once. It might be that you focus on a domain each month, and then you can allocate various different members of staff to review those records and see why that patient is on there and whether you can add them to a register. Bear in mind that for some of these things, it will highlight data quality issues because sometimes codes get added in error. So where there is a code that was added in error, just remove the code, and that will also remove them from the case finder report from there. So that is your case finders. The last bit just to cover with you here, just kind of going through some of these various different tabs. So if I click on my vaccinations tab here, this is where you will find those childhood vaccinations, which we talked about earlier. So you've got your VI 1, 2, and 3, and then there's also shingles for number 4 on here. So again, really useful on here to be able to track those patients. So click on that view button, break down each one of those reports. We can then start to analyze what kind of patients we've got in here, what their demographics are, maybe perhaps what other conditions there might be. I'd imagine for the children there might be very, very little, but you've got access to that. And most importantly, you've got your patient list here. So with your patient list, we can see here that 2 of my patients have already had that, whereas the other ones are still to do. The comments feature works really well here because, again, for any of those children who are not responding or where the parents have refused the vaccinations for them, you can record that on here. Now, there is some new changes this year around the childhood vaccinations, and there's an improvement process in place this year, which I believe they're going to start looking at what your previous year's achievement was, and there's an additional payment that can be paid if you are doing better than the previous year. So it's all about improvement. We don't have any functionality available just yet for that one. We're just finalizing the last few things there, but do look out for that when that functionality is available. Now, the last thing just to say before we move on to the network DES, is that for those of you who have used the QOF dashboard, you will know from previous years that there is an additional payment tab available. The payment tab hasn't been released just yet because we're still waiting for business rules from NHS England to be able to finalise that, but keep an eye out. We will let you know when that is live, and once it's there, you'll be able to track your payments. Just in the interest of demonstrating it, if I go back to last year's QOF, for those of you who are new to the dashboard, just to show you roughly what to expect. When you activate your payment tab on the dashboard, it will look exactly the same as your data, but this time it will just summarize the financial values for you. So instead of having just points on the overview, you can see exactly what income has been achieved, what your missed income is, and also what the value of your case finders are. So the reason I've come onto this one is with the case finders in mind, particularly, it can give you an indication in your planning stage as to what those case finders might be worth in terms of financial value. Now, as we scroll down, you'll see that each one of these indicators will summarize the financial values again, so we can see how much is achieved for the indicator and also how much is outstanding. So for those patients who remain, what is their financial value attached to that, even down to what the pound per patient value is on that one. And as we said, for case finders, if we look at the case finder section here, I can see that for last year, I had 95 patients on my hypertension case finder, and that was worth a total of that amount of money there. So hopefully this gives you some idea as to how you can use the dashboard to plan. Just before we move on to Network DES, Charmaine, can I just check if there's any questions related specifically to QOF?
I think it's just a general question that I'm going to ask you, if that's okay. Obviously, there's a lot here, and we want practices to be really using it throughout the year. That's the whole point, to keep them on track. So if you're quite new, where would you suggest they start first? So they're going away from the webinar now. They want to start incorporating it. What's the first task would you get them to do?
First task I would get them to do is have a look through your overview and see how many patients you need to get to maximum for each of your indicators, and do that quick math to see how many patients you need per month to achieve, so that you know whether you have enough capacity in your workforce to be able to achieve that.
Amazing, thank you. In terms of questions, we've had some users who can't see the work to do column, which shouldn't be the case, so we've pointed them to support. We've had a couple of people answer about patient level data and being able to view that from group level, and at the moment we haven't really got a ETA on when we expect that to happen, but we will keep you up to date. And I think that's probably about it for now, so I think we're okay to go to network contract DES.
Lovely. Let me just bring the slides back up.
We will share these slides with you as well, because particularly for Ardens Clinical, we've got so many resources to help you with recording data, etc. It will explain it all in the GP contract webinar, but these slides also mention them too, so we will make sure we share them with you. But in terms of network contract DES, again, not massive changes at all. For IIF, learning disability, no changes, so still the same as last year, your health checks, etc., ethnicity being recorded. For cancer, though, they have made it clear that they're going to give you clearer requirements for referrals. So this is particularly looking at early diagnosis and screening. Continuity of care, so PCNs must identify a high-risk cohort and they must embed continuity of care within their organisations. We did a whole webinar on that just a few weeks ago, so we will make sure that we share that with you, but we can help you in that area with everything, so please do make sure that you've had a listen into that. They also spoke about the additional roles, particularly looking at experienced GPs and expanding in that area, and advice and guidance is no longer. So like weight management's been shifted in network contract DES, advice and guidance has as well. So it's not particularly in this contract, but you'll still be doing it outside of this contract, if that makes sense. So very, very little. So I'm going to pass you back to Mariette.
Lovely. Thank you, Charmaine. Just before we dive back into Ardens Manager, so the things that we're looking for in the network DES will be very much the same as with QOF. So again, make sure that you've added any additional staff on that will be monitoring your network DES. use the platform to understand your population health needs, including identifying those high-risk patients. Review your workforce and capacity, and I'll show you how to do that on the Network DES dashboard. And support your practices with that delivery. So with that in mind, let's hop back into Ardens Manager. And this time we're going back onto contracts, and we're going to go to the Network DES just underneath there for 26-27. Now we're going to go over the exact same functionalities we did with the QOF dashboard, because a lot of those things apply to your network contract DES as well. So you'll see you've got the overview page, but again, you've got the separate tabs there to look at individual parts of that service. Data tab is available, so all of those reports are on there, and you do also have the payment section as well, which we'll cover in just a sec. So I'm going to work my way through these tabs, starting with the IIF. Now your IIF page works exactly the same as your QOF dashboard. So on here, you will see that you've got those traffic light indicators for your learning disability and your cancer referrals. So really, really easy to track what the progress is. Just before I go any further with this, for anybody that happens to be following along today, you'll notice that when you first click onto your Network DES dashboard, it defaults to your PCN view in this bar just at the top under the data tab. That is deliberate because it is a PCN-wide contract. So this will show you the aggregate information for your whole PCN. If you don't want to see that and you just want to see your own practice, just click the drop-down menu and pick your practice from the list up there. That will then reset the dashboard to just show you your information. So working our way down, some additional things you've got with the Network DES to help you. Obviously, we know what our progress is with this. We can see how many health checks we've done and what our thresholds achievements are. But what you might want to do is take a particular look at the data quality section here, because that will also highlight for you where there's work that's incomplete. And again, if you're starting off the year with work that is incomplete, that's going to skew your figures. So do factor that into your planning phase. But as with QOF, we can take a look at those two indicators for the IIF. We can see how many patients are within each indicator, and crucially, how many do we need to get to our maximum threshold for the year, and then do that same calculation. Divide that by however many months are left, and you'll know how to manage that going forward. Just coming on to the payment tab here, specifically for the IIF. So as we looked at for the QOF dashboard for last year, this year's Network DES does have the payment tab available already. So on here we can see any income achieved. Currently I've got none because I haven't reached my minimum thresholds, and I can see what the missed income is as well. So it gives me an idea of how much I can expect to achieve if I get full threshold achievement there. Now, for the other tabs that you've got on here, the next one I want to show you is the capacity and access tab. The majority of this page is based on national data sets because it's looking at various different things like patient experience, your GP workforce, as well as some of the other elements around access. You've got your GPAD information on here as well as triage, community pharmacy consultation services, and so on. Lots for you to unpick here to monitor how you're doing and what patients' views are. But the bit that I did want to show you that will help you with your planning phase is this workforce capacity section. So this is based off national data sets that practices and PCNs submit, I believe it's once a month, to their local ICB or LMC. If we start with, first of all, GP workforce, we can see that it's giving us all FTE, so that means your full-time equivalent. So this is grouping all of the different roles you've got in your practice together, or you can split it out by GPs, nurses, direct patient care, and so on. I'm just going to use the all FTE button here. So if we're going to click view, I can see that across all of my roles, I have the equivalent of 472 full-time members of staff. I can click the view button, and then we're going to break this down. Now, because this is a national data set, you're not going to have as much on the right-hand side to analyse because this is not data that we have access to for those analytic purposes. It's just taking the raw data from the national data sets. But the bit that I do want to show you here is you'll see that it says view breakdown just above your benchmark table. When you enable that, it will then start to break down all these different roles for you. So at the top of the list, my direct patient care, I can click on the little chevron there to start seeing what that looks like. So in terms of pharmacists, I have 20.9 full-time equivalent pharmacists. Healthcare assistants, I've got 19.5. So remember, this is grouping it together, aggregating it for the whole of my PCN. Just underneath that is your benchmark table. So if I wanted to see what that looks like for my practice in Garden View, I can click on them and that will then update the figures. So for me, in my practice, I've now got 17.3 full-time pharmacists and so on. So you can kind of work your way through the list and it translates onto the trend chart as well. So we can see that my recruitment must have spiked here because I've got a lot more staff available now compared to previous years on there. So really handy tool when it comes to your planning phase, because as you're planning to look to see how many appointments you need, you want to go back and have a look and see in terms of your workforce, what is your actual capacity like? And if you are struggling for capacity, this can be quite useful as well, using the trend chart to look back at a period of time where perhaps you were very well staffed, and that will give you an idea as to how many full-time equivalent you need to get back to that to be able to fulfill your patient needs within your practice. With any of the other data sets, you do the exact same thing. So if you are wanting to monitor your GP patient survey, just remember once you break it down and click view, you do have that view breakdown toggle there to get to the nitty-gritty information behind that. Something else that you will find on your dashboard, and I'm just going to go back to the overview to show you that, is there's something called organizational activity. Now you don't have to complete this. It's just there in case you want to make use of it. And what these ones do is it's information that we cannot extract from your clinical system. So it requires a manual input. So for your network DES, this largely relates to the funding itself. So whether you've had your additional roles reimbursement sum, your care home premium, or that core PCN funding related to that one. These ones you can view via the payment tab because they are linked to payment. And for your network DES, you'll see that that is what makes up the majority of your missed income. Now, if we scroll down, you'll see you've got those 5 indicators just on here and the amounts associated with them. If you want to move them over to the achievement side, you just need to add the information into there. Really, really key note here. At practice level, you cannot add information because this is a network contract. So your PCN would have to add the information here. So I'm just going to swap to my PCN site so that I can show you what that looks like from PCN level. So scrolling down the screen, you can see I've now got the plus add buttons next to them. So all I would need to do is to just click the add button. I can then add some information and mark it as complete. And once I've done that, it will then move, it will turn the indicator green and it will move that finance over to the achieved column. So once the screen refreshes, you can see I've now got achieved there for my care home premium, and it's the same for the one underneath it. So again, you don't have to use those, but they are there if you want to keep all your information in one place. So that covers everything for your network DES. It's a much smaller dashboard compared to your QOF. Just to say on the contract tab as well, you have got access to the specifications if you did want to read in more detail there. Charmaine, just before we go back to the slides, any questions from anybody on that one?
No, I think that's pretty straightforward, that one.
Fab. So coming back to the PowerPoint. So on here again, as Charmaine said, we will share the slides with you, but we've got resources in the clinical system as well that will help you to record your information. So I'll hand you back to Charmaine now.
Thank you very much, Maria, as always. So in terms of next steps then, really hope that you found that useful. I'm sure you have. There's lots there. And remember, it's here. If you've got it, use it, make the most of it, because ultimately it's going to help you with your performance throughout the year, so that we're not having that mad rush in the last 3 months to get all of the last points. We want to try and relax that throughout the year, and that's where Ardens Manager can really help you. And we will do some more training sessions, particularly in these areas, across the year as well, to support you with that. So what we would suggest now is really reflect on the webinar. There's a lot of information that you've received today, all useful, but reflect on it, access our support articles, and then work out how it's going to work for your organisation, and hopefully quite straightforward when it comes to Ardens Manager. Making sure you've got all of the right staff members to access the platform too, so that you can just get off on a really good start. So start planning now. Mariette has shown you how you can do that for both QOF and network contract DES. And please do make sure that you book in some training. Good chance actually to answer that poll question around training, because it'd be really good. Remember, we offer lots for training. Do you want to just go over, actually, before you do that, Mariette, I know Georgina has posted it in the Q&A, but if you're not an Ardens Manager user and you want to sign up for a free trial, then you can do that. You get a free 1-month trial, so you can view the QOF dashboard, you can view the network contract DES dashboard, so definitely worth doing. Next slide for me then, Mariette. So we offer loads of different training. We offer practice training. Either we can come and see you in person, or we can do it remotely, and it's all free if you're a customer. We recommend that you book training every single year at least once. So you can email us at training@ardens.org.uk. We've also got our support team, so if you're stuck at that point and you want to speak to someone in real time, then either on your Ardens Manager homepage, you can click on the little orange button for help and you can speak to one of our colleagues, or you can email support@ardens.org.uk. Remember, we offer practice training, support articles, webinars. We also offer Ardens Academy, and we will update Ardens Academy in order for you to be able to complete that online too. So I'm just going to launch a real quick question, because it'd be really good to see. Hopefully you're making use of a lot of these training resources, but do let us know currently whether you're not, or if you are, what are you using? Are you finding helpful? You should be able to pick more than one answer, hopefully. So let us know. Would be good. We've still got over 70 people left on the webinar, so it'd be good to get lots of responses. We want to make sure that we're providing you with the right training resources. Lots of webinars, not so much Ardens Academy. And I think a lot of that is because sometimes practices are not actually aware it's there, and it's such a useful resource. It's free, and you've also got CPD points attached to the Ardens Manager Guide. So if you complete that, you get CPD points at the end. So that might be a good one for your clinicians. We'll put a link in to how you can sign up to that. We are going to be adding more and more guides throughout the year as well. So that leads us to our last slide, coming up to the end time now, which is really feedback. Hopefully you found it really useful. We value your feedback, whether it's about the webinar that you've received today, the content, the features. Just let us know your feedback. Just scan that QR code. That will take you straight to the feedback form. It doesn't take long to complete, and we really hope you have found that useful. So we haven't got any big massive webinars over the next few weeks, but we are doing a lot of getting started webinars. So if you've got new staff members in your practice who haven't had any Ardens training, then look at our upcoming webinar page and get them booked on. We're also going to be doing training for pharmacists around June time, so do make sure that you're looking out for that. And if there are any webinars you feel would be useful, put it on the feedback form, put it in the Q&A, and we can definitely consider that as well. Thank you very, very much. Thank you, Mariette. That's really good. We will hang around in case there's any more questions, but other than that, I hope you all enjoy the rest of your afternoon, and thank you very much for joining us. Thank you for your reactions too. It's always good to see.